Dr. Carin here. I hope you're doing well today. I am very excited to be back in the kitchen, continuing the series, Everyday Tools to Transform Health. These are tiny little everyday tips that can make huge impacts on your health. Before I continue here, I just wanted to remind you that there's a few more weeks left to enter the Brio Bingo contest. And one of the activities on there, right under the O, is earthing. And we just have our amazing Dr. Dario wrote an article all on earthing if you want to find out more about what that is, and you can check that box off as well. All right, so today I want to give you some tips on taking supplements consistently. So why are we talking about this? As with healthy eating, of course, consistency is really important for getting the most out of your supplements and your medications too. But that means that we need to establish habits around taking the supplements or medications. And of course, good habits matter because they help us get better results. But really, their true power is that they can change our beliefs about ourselves. And let me explain what I mean by that. So when we build systems to take our supplements regularly or to meal prep and regularly cook and eat healthier, these systems not only help to get the job done efficiently, but they also over time become evidence to ourselves about what we value, health. And in other words, they actually reinforce or transform our identity to someone who prioritizes health. And when we shift our identity, that actually impacts the decisions that we make, not just in taking our supplements or with our healthy eating, but in all areas of our lives. So these little habits can end up having even greater effects. The author James Clear says the goal is not to learn an instrument, it's to become a musician. So the goal is not simply to remember to take our pills every day, but it's to embody the belief that health is important to us through our daily habits. So that's our goal. So here are some of the challenges that I have run into with taking supplements and medications consistently. First one is for sure just forgetting, especially when the routine changes. If I've forgotten to take my supplements, it's mostly on the weekends or during a holiday when the routine is different. Another issue that we run into is even if the supplements are really well tolerated, we often don't have that immediate feedback with supplements, whether we feel fantastic or whether we're reduced symptoms right afterwards. We don't have that feedback usually within seconds or minutes of taking a supplement. Or the negative feedback of if we missed a dose, we don't really feel that right away as well. So that makes it difficult to reinforce that habit of taking the supplements consistently. And then of course, there's that difficulty of just misunderstanding directions or not being clear about why we're taking the supplement or the medication and how it fits into the overall plan. So those are some of the struggles and challenges that I've run into with taking supplements consistently. So the two tips that I want to give to taking supplements consistently is co-plan with your practitioner and then incorporate that supplement taking into your routine, into your day-to-day life. And there's 4 specific tips I want to give on that, which are using reminders, especially visual ones, making it simpler to do each day, as well as linking taking supplements to a habit you're already doing. And then lastly, make taking supplements more attractive or satisfying to do, and that helps to reinforce that habit. So I'll go into more detail on this in a moment. So this is going to be applying to supplements, herbs, nutrients, vitamins, minerals, tinctures, protein powders, fish oils, remedies, even prescription medications and over-the-counter medications too. So co-plan with the practitioner. This is a really important step, of course, mostly because this way we get to really understand how the supplements fit in with your overall plan. I find this really important and helpful to actually remembering to take the supplements, but also to help me understand what are the symptoms that I should be monitoring for, the improvements, or side effects that I need to monitor and then report back to my practitioner. And then also this helps to understand how long we're going to be taking the supplements for. Is it a month? Is it 4 months? So that we can also plan with the refills as well. And then secondly, when co-planning with your practitioner, find out the ideal way to take that supplement. So is it at nighttime? Is it in the morning? Is it right before bed? Is it with, without food? Does it matter? Can we be flexible about that? Is it with a clean mouth? And what does that mean exactly? Is it on an empty stomach? So how far away from food is that exactly? Is it okay to take with other supplements or with the medications that you're taking? And then lastly, discuss your preferences to make it easier for you. So is there a form? Do you prefer, for example, capsules over a liquid? Do you prefer taking all the doses just at once in the morning, for example? Or do you prefer taking less capsules and spread it out 3 times a day? If you have a preference, ask a practitioner if that works, and make it so that it would be easier for you to do. And then lastly, are there any ways that you can make that product, some combination of those products so that you have less bottles that you're dealing with and make it simpler for you? So having all of that information really helps to be able to incorporate now those supplements into your day-to-day routine, because that's what's really going to make it easier and more consistent if you could fit it into what you're already doing in your day-to-day life. So those 4 major tips that I'm going to give you for incorporating that into your day-to-day. So number 1, and this is a big one, is to use reminders. And visual reminders are one of the most powerful reminders that we have. So for example, if you're taking supplements with food, which many of the vitamins and minerals are taken this way, fish oil, things like that. If you want to take it with food, put it in the room that you actually normally cook or eat. So I'm standing in the kitchen right now, and I've got the supplements in here, usually on the counter or on the dining room table. So it's right there when I'm about to eat. I can see it there. And as you can see, if you have multiple bottles like me, I like to keep it just on a little special tray, mostly because it's just easier to pick up and wipe the counter underneath it, for example. But it's just another quick visual cue that there's something there for me to look at when I'm in that area. If you don't want to keep your supplements on the counter or the tabletop, if you need to keep them away from small children, for example, then you can put them into your cupboard, but do this strategically. So again, use the visual cues. If you've got a habit of, say, drinking tea every morning, and that's not a habit that you tend to forget, then put the bottles in the cupboard right beside the mugs that you use for tea. So you'll see it right away, and it's very reliable that you will see it right there every day. So that's another way that you can use a visual cue without having it left on the table or on the counter. What about if you have to take supplements away from food? I find that some of my patients have a harder time with this. So taking supplements away from food, that means that we want to keep those supplements in areas where you're not eating. So that might be on your work desk, either at home or at work. That could be on your nightstand in your bedroom, or on the bathroom counter beside your toothbrush. I have a patient who also keeps their supplements on their table right beside their reading chair. So that's another place where they tend to not be eating, but then they have that visual cue to take that supplement. And another sort of bonus tip here, I would always try to keep a glass of water in that spot. So I often have a glass of water on my nightstand for that. So that way, because my bedroom is upstairs from the kitchen, it won't stop me from taking that supplement. As soon as I see it, I can just take it and not go all the way downstairs and get a glass of water. So keeping for supplements away from food, keep them in the area where you're not eating, make it visible, and have a glass of water there as well. So it's ready to go. Okay, what about taking multiple doses of day? Because this makes it a little bit more complicated for sure. So what I like to do, I don't know if you can see this from here, but I have a little dish like this is obviously a little soy sauce dish, but it's a perfect size for putting the supplements into. So in the beginning of the day in the morning, I put all of the supplements, little pills, into here. And then I take my morning dose. And then if I have anything left over in there, that's my dinner dose, or the dose that I take at dinner time. And those will be sitting in there right by my tray here when I go back to the dinner table, or the table at dinner time. And then I'll see it, and that would be kind of my second reminder, a second visual cue that not only do I have to take the supplements, they're in here and they have to be taken, and this dish needs to be emptied out. Hope that makes sense. So that way they can get multiple doses in, and you can get multiple reminders about that. There's other ways, and I'll go over that in a second. Another one that issue that I run into is when we're kind of wondering, did I take my pills? I don't remember. Did I do that? I can't remember if I'm remembering from the day before, that kind of thing. That could be a little bit tricky too. Another trick that you can use is after you take your supplement for the day, you could just turn the bottle upside down and keep it that way. So at the end of the day, you know that you've taken that particular one or all of the bottles that you're supposed to. And you can do this for your medication as well, just turn it upside down. Another one that you can use, another reminder, is to set an alarm on your phone or your calendar. So if you need to take a dose at a busier time in the day, like right in the middle of the day is a tricky time to remember to take medications or supplements. So putting an alarm on your phone, on the clock app. You can set it so that it recurs every day at the same time, and there's a little alarm that will remind you to do that. You can also use your calendar for this. So I have some patients taking herbs only certain times of the month. For example, 1 week leading up to their period. That can be really hard to remember. So definitely would put that into your calendar as soon as possible so that you get that reminder coming up on that day. And you might want to do it for every day of that week if it's just for 1 week out of the month. So a reminder on your phone, either on your clock app or your calendar app, can be super helpful to remind you to take your supplements as well. Okay, second tip for incorporating supplements into your day-to-day routine is make it really simple. This is where pill boxes can be so helpful. The pill boxes are the ones that are the boxes that have the days of the week on them with a little section for each one. This is something that you can just set up maybe on a Sunday and fill it up for the whole week. That makes it really simple. On the day of, you just take what's in that section and you're done. And it's a really nice visual reminder that it was done as well. You can find pill boxes that actually have different times of day as well if you have multiple doses that you need to take. That can be really helpful. A lot of my patients feel a little bit sheepish using pill boxes, but I think it's brilliant. It's a great idea. And if you do have to take most of your medications or supplements with food, then I would recommend keeping that visual cue in the kitchen or where you eat, generally dining room table maybe. All right, and third tip, link taking your supplements with a habit that you're already doing. So if it's something like, if you need to take a supplement away from food, then choose to do taking the supplements after you, say, brushed your teeth or flossed your teeth. So a bit of a 1-2 punch. You can say brush, floss, pills. And set it up that way. Now, in the beginning, you might have to put a little sticky note on your bathroom mirror to remind you to do that. But after a while, it will become connected. So you'll remember as soon as you brush and then floss that the next thing was the supplements, and it'll become routine that way. You can do this. We talked about the connecting your tea drinking in the morning with the supplements sitting there in your cupboard. So that's the same type of linking idea. You can do this in the evening. Maybe you have a habit of drinking tea after dinner and you can connect it that way as well. Maybe you have a habit of reading a book when you first get into bed. And so putting your supplements that you need to take on an empty stomach on top of your book on your nightstand with that cup of water would be a nice way to sort of link those two habits together. And so it's less difficult to get that new habit in if you just piggyback it on a habit you already have. Hope that makes sense. Okay, and then lastly, make that taking of a supplement, make it more attractive and satisfying to do. So this is easy when the supplement, like a protein powder, tastes really good. Then you almost look forward to taking it, and it really does make it a lot easier to remember to do. But if it's not particularly delicious, like swallowing fish oil is not particularly attractive to do, then doing something like taking all your supplements and then rewarding yourself with a little piece of dark chocolate or a small sip of juice or something like that to reinforce that habit can be helpful. If you're somebody who likes to check things off on a list, like me, marking an X on a wall calendar that's right by your supplements or medications can be a nice way to sort of get that satisfactory, yes, I did that, check it off the list. And also is a nice record, later in the day when you're thinking, did I take my supplements? Yes, I did. It's on there. So that can be a nice way to make it a little bit easier to do. Now, if you're taking some things that, like a fish oil that's liquid, that might not be the most delicious thing to take, then experiment with it. This is the same with spirulina or chlorella, to make it delicious to take so that you do look forward to it. Add different kinds of fruit. Ask your practitioner for ideas on this as well. Cacao can be a really nice addition to spirulina, and actually has a pretty good match with the flavor. So things like that can really make it more satisfying, and you might almost look forward to doing that. So that can be really helpful. So the main pointers for today. First one, most importantly, co-plan with your practitioner. Understand how the supplement fits in with the overall plan so that you know why you're taking it, as well as what's the best way to take it. The other thing is make sure that you're monitoring for what you should be observing for. So side effects, improvements, things that you need to report back. And then figure out what's the ideal way to take that supplement and talk to your practitioner about that. And even maybe the most important is discuss with your practitioner ways to make it easier for you based on your preferences and your day-to-day life, whether that's preferring to do a capsule over a liquid or preferring something that has some sort of flavor or no flavor, doing 1 dose versus 3 doses. Usually there's a lot of flexibility here, and always want to find a way that will make it work for you. All right, and then how to incorporate those supplements into your daily routine. Here's a summary. So using reminders in your environment. So visual cues are really important for this. So having them, if it's taking it with food, having them in the kitchen. If it's taking away from food, maybe in the bathroom or your desk, having a glass of water with that. And then simplifying the regimen as much as possible. So reducing the number of steps that you need to take the supplements. So pill boxes are just so great for this. And then, of course, having that water glass right beside the supplement just makes it that much easier as well. And then thirdly, linking to a current habit you're already doing. So brushing your teeth and then taking your supplement, for example. And then lastly, make it attractive and satisfying. So improving the flavors, mixing it into a good smoothie, checking it off on a calendar, or even finding attractive pill boxes or little cute dishes like this that helps your eyes go to that visual cue even more. And that can be really helpful. I see a comment, I mix up my doses with my husband, so we write on the bottle caps with our initial so we can remind each other. Nice ideas. Yes, so you can actually mark at the top here whose bottle it is, and also information like doses. How much should you be taking? You can also, if you have multiple bottles, you can have 1 tray for yourself, 1 tray for your husband. That sort of thing would be really helpful. Make it really clear whose bottle is who. All right. If you have any other tips, I would love to hear them, and I'm sure that other people could use them as well. So please leave them in the comments. If there was a tip here that resonated with you today, please apply that this week and try it out and let me know. These tips, of course, are to help us remember to take our supplements, but also really reinforce those daily habits and reinforce our health values. So that's really the value there of doing these, establishing these habits. So if you know of any friends or family that could use this information, please share this video with them. We'd be happy to help as many people as possible. And again, if you have any tips that you'd like to share that I haven't mentioned, please write them in the comments. I would love to hear them, and I'm sure that other people could use those tips. All right, that's it for me today. As always, it was fun chatting with you in my kitchen. Thanks for joining me today, and we will see you next time. Thanks. Bye.